Good evening, everyone. I'm Dr. Candace Lucas, Senior Vice President of Equity and Advocacy at the Urban League of Rochester. Thank you for joining tonight's webinar to learn about the progress made on the RASE recommendations since they were delivered to former Mayor Lovely Warren and County Executive Adam Bello in March of 2021. As you may recall, the Commission on Racial and Structural Equity, known as RASE, was established in June of 2020 after the world witnessed the murder of George Floyd at the hands of the Minneapolis police. In response to local calls for systemic and institutional change, the mayor and county executive appointed the 21-member commission to do three things. One, inventory and assess current local laws and policies that either promote or are intended to eliminate institutional and structural biases, racism, and inequities in the city of Rochester and Monroe County. Two, provide recommendations to enhance the current local laws and policies to increase their effectiveness and/or sunset local laws and policies that are ineffective or no longer applicable. And three, provide recommendations on any new local laws and policies to address identified gaps. In a nutshell, the intent of the commission was to examine and develop policies and legislation to overcome systemic and institutional inequities and racism in Rochester and Monroe County. The commission, along with hundreds of community members, was seated for 6 months. In March of 2020, they delivered more than 200 recommendations to the mayor and county executive, spanning 9 sectors that impact the daily lives of all Monroe County residents, including business development, criminal justice, education, job creation, healthcare, housing, human and social services, mental health and addiction services, and policing. The commissioners knew this was not going to be an easy lift and that it would take the efforts of each and every one of us to bring equity to Monroe County. At the release of the report, the commission called for the establishment of an organization that would monitor the implementation of the recommendations and for an annual reporting to the community on the status of each recommendation. This evening's webinar is in direct response to the request of the RASE Commission. You will hear from representatives from the City of Rochester and the County of Monroe on what actions they have taken on the recommendations to date and their plans for future activity. You will also hear from community partners who have taken leadership roles to help implement some of the work, and they will share ways that you can get involved moving forward. We thank former Mayor Warren and County Executive Bello for championing this initiative in our community, as well as current Mayor Evans for continuing to prioritize the work of the commission. We also thank all of you dedicated community members who worked with the commission to develop the original recommendations, and those of you who have stepped up to help implement the recommendations. As a community, this is our chance to shape Greater Rochester in what we know it can be. The RASE report is our blueprint, and we each have a responsibility to assist in improving our working and living conditions. This evening's webinar is being live streamed on the City of Rochester's YouTube channel. It will also be recorded, and it will be posted for future viewing. It is not too late to invite your family, friends, and neighbors to join the webinar or to get involved in this work. If you would like to reference the RASE report or learn more about the RASE Commission, please go to www.rocrase.com. And with that, I would like to turn this over to Dr. Chanel Hawkins, the President and CEO of the Urban League of Rochester, for her opening remarks.
Thank you, Dr. Lucas. We are just thrilled that you are now serving at the Urban League of Rochester. And before I begin, I just want to welcome, there are over 146 people that are on this call right now, and the numbers are growing. We need everyone to know about the work that's being done and the updates. So right now, I'm going to ask you all to share, post on your Facebook, call a friend, text a friend, and share the link and let them know that this is happening now. It is not too late to be involved. And with that said, I want to thank you for being a stakeholder. I'm excited because the Urban League has a major role in advancing the recommendations, and so do you. The Urban League has been serving the Rochester community since 1965, and in 2025, we'll be celebrating 60 years serving the greater Rochester community, and we are a growing team. The Urban League of Rochester is a civil rights organization, and our main goal is to advocate and provide social services to the community that we serve. Our mission is to enable African Americans, the Latinx, the poor, and anyone disadvantaged to secure economic self-reliance, parity, power, and civil rights. And we do this in 4 ways. We have a 4-pronged approach. 1, we ensure that our children are well educated and equipped for the 21st century. 2, we want to help ensure adults have access to economic self-sufficiency through good jobs, home ownership, entrepreneurship, and wealth accumulation. And to ensure that civil rights are eradicated, or civil rights are accessed by eradicating all barriers to participation. And then 4, we want to ensure that all of our staff are provided the tools to educate, advocate, and fulfill the mission of the Urban League. I'd like to thank Mayor Evans and County Executive Bello for their confidence in appointing the Urban League of Rochester as a successor body to advance the RACE recommendations. We want to work in collaboration with the city and county leadership to actualize the RACE recommendations, and we're doing that work today. We also have committed, I want to just point out our staff, because we have committed our staff to advancing the RASE recommendations. And most importantly, if you look on the screen, you'll see that our staff is very diverse. We're committed to diversity, equity, inclusion. So on the next slide, I'll talk about what we were contracted to do. So the Urban League of Rochester has committed to serving as the successor body to advancing the RASE recommendations. And what we've committed to doing is working in collaboration with the city and county to advance the recommendations. Additionally, we want to ensure that we serve as the point of contact for the community and act as the convener of conversations about RASE and updates as demonstrated in today's conversation. We will also review and comment to the county and the city on Cedar Grove's work product, organize committee led by community leaders and stakeholders. And I want to thank every CART facilitator and team member for staying focused on advancing recommendations in the area of policing, criminal justice, education, healthcare, mental health, addiction services, older adults, housing, job creation, business development, and human services. And lastly, we will prepare an annual report. Next, I would like to welcome and introduce the consultants to the RASE efforts. Cedar Grove Institute for Sustainable Communities. We have Jeannie Bonds here, and I just want to recognize Dr. James Johnson in his absence today. Welcome, Jeannie Bonds.
Thank you so much. We're delighted to be here and happy to have been working with the city and county, the working groups, and all the stakeholders over these past few months. Our role in this process is to, well, first of all, let me say our expertise is in evaluation and in helping communities frame issues like this, look at national best practices, and develop roadmaps so the community knows where you are now, what actions you're taking, and how well you're doing over time. So to that end, we've been working with the working groups that you've already heard the names of those, and seeing where they are as far as collecting data and looking at the performance of some of the issues so far. Our role then is to take these working groups and start to look at charting the progress of these groups. So we look for key performance indicators, which we can gather from national best practices as to how to measure progress in each of those groups. We look at measurement tools. So we have a KPI, then how can we develop the measurement? And to do that, we need data collection. So we're working with those groups to pinpoint what's the best way to share with the community how well you're doing in all of these areas. And the last piece of that is national best practices. We can look across the country, and while other communities have not organized the same way that you have. They have elements of your working groups and work they've done. So rather than reinvent the wheel, we look at those national best practices and bring those to Rochester and Monroe County and see which ones fit and see if there's ways that we can mimic what other communities have done to measure and evaluate their progress. Once we've done all of that, our next step is really this collection of data piece, which we're well into that now. We need baseline data. Where does this community stand on jobs, on healthcare? What is your baseline in order to define where you want to go and how you want to improve? Part of that baseline is looking at larger coalitions that oftentimes include the private sector. I'll use an example of housing. We need to know how many housing units you need that are affordable. And then we need to look at the private sector and see if there are private developers that are building housing. And then we need to start to count and put those data points together. So we need information from the private sector as well as a variety of other public actors, which may not have been as intimately involved in this process as some of the agencies you're going to hear from this evening. Once we've done all of that, we're starting to put all of this together in a dashboard. So let me just go through the timeline a little bit. It's establishing the baseline data for these 27 indicators, which are the top 3 priorities for each of those 9 working groups. And we're doing that now. And we're almost finished with that. And that is a team effort, the staff of the Urban League, the city, the county, and others that are helping to pull that together. We're going to gather the most recent data that we have that's going to start to show that progress. And we've been doing that all along, and we'll do that this month and next month, again, with that same group working. And then we're going to start to calculate and put together a tool to show how much progress has been made towards each one of those goals. And we'll be doing that for a while into June, possibly July with that group. And then we're going to create a dashboard that we will load on the website so that the community will be able to review it. And then we're going to put that out, publication, fixed up nicely so that from here out, the community will be able to track the progress. So that's the role of Cedar Grove. And again, we're thrilled to have been involved in this. It's an exciting project, and we're looking forward to continuing on for the next few months and start to really pull this together for you to see the work that this community's put in. And now I'm going to turn it over to Corinda Croisdale.
Thank you, Janine, and thank you to Cedar Grove for all of their hard work. I'm just going to walk through in each one of those areas from the county's perspective on where we were able to move some of the RASE recommendations forward. And looking at the area of business development, there were 3 overarching themes, one being inadequate access to capital for BIPOC to open up new businesses. Attached to that was not having enough information so that the BIPOC potential business owners can move in that direction. Another area of concern was with MWBE. There was a feeling that the process was very clunky and very cumbersome and made it even more difficult for BIPOC to access MWBE, either contracts or become business owners. So in this area, Monroe County developed its own MWBE certificate program that was launched in 2022. Since then, we've also held in partnership with the city an MWBE Business Development Fair. In doing this, it allowed quicker access for business owners here in Monroe County to become MWBE certified. We have over 200 individual or companies certified as MWBE here in Monroe County. In addition, through the joint efforts of the city and county, through the Business Development Fair, we were able to provide more access to BIPOC business owners and potential business owners on how they might move to business ownership. We will be holding a second annual fair. We're looking thus far at doing that in the month of July. And again, that'll be in partnership with the city of Rochester. In the area of education, what we learned through the RASE Commission was that there was inadequate mental health support and emotional support for some of our children, particularly in the Rochester City School District. We also learned that language access was a barrier to some of our students being successful. So we worked very closely with our Office of Mental Health. We have a fierce director who has advocated with the State Office of Mental Health to ensure that we have equity with embedded mental health clinics in our Rochester City School District. She's made a lot of headway in that area. We also looked at adding some funding in partnership with the City of Rochester to develop more equitable pathways to behavioral health in accessing or allowing families to access behavioral health services through untraditional means. And then finally, through the Monroe County Community Integration Initiative, we are looking at where we might find opportunities to integrate some of our systems, particularly mental health and youth services in the Rochester City School District. In the area of job creation, what the report revealed for us is that there was inadequate access, particularly through the civil service process for primarily BIPOC individuals securing good paying jobs. This was through promotion opportunities as well as access to civil service exams. We also found that there was barriers to equity with accessibility. This included transportation, childcare, as well as pay. So the county's taken steps to make it easier for individuals in Monroe County to access civil service exams. So all civil service exams are now free. We also waived the $100 drug testing fee for individuals who are potential hires for Monroe County. In addition to that, we have a fierce recruiter who has been helping us recruit more BIPOC to take the civil service exam. And our Office of Diversity, Equity, and Inclusion has been working with our departments to ensure that we have diversity action plans that have built-in mechanisms to ensure that our BIPOC employees have access to upward mobility in higher paying jobs. And then finally, just wanted to add that Monroe County is no longer testing for marijuana, and we also removed our lifetime ban for individuals who tested positive for drug usage, which is a condition of employment with Monroe County. An area of mental health and addiction services, what we found was that there was insufficient access to quality behavioral health. To quality behavioral health services. There was a feeling that we lacked diversity and cultural competency with regard to our mental health providers, and that the mental health services didn't seem to connect with the community. A couple of things that we've done since the commission report came out, we rolled out a BIPOC peer support program, ensuring that individuals who are in the behavioral health system have access to peers who look like them and have an understanding of their experience in that system. In 2020, the county executive also sanctioned a 90-day study at our entire behavioral health system and making sure that we're investing in a way that supports our BIPOC community. The Office of Mental Health has developed metrics around the 90-day report, and that can be found on our county website to ensure that the recommendations in that report are pushed forward. The county also continues to review policies surrounding attendance and compliance with our substance use disorder programs. We did find that Monroe County had higher sanction rates than other counties of like size. So we're looking to ensure that there's equitable decision-making with regard to sanctions here in Monroe County. In the area of healthcare, no surprise, what we found in the report was that there needed to be a greater focus on the impact of racism in the healthcare system. Also ensuring that individuals who are typically at the lower pay grade, who typically are BIPOC, earn a living wage. And then finally, looking at some of the social and economic inequities with regard to access to other health systems and other social determinants of health, such as food, and making sure that there's recreation spaces. So in this area, our county executive signed on to the declaration declaring racism a public health crisis that occurred in 2022. Also, through local law, the county executive established the Office of Diversity, Equity, and Inclusion, including in that local law. Each county department is now required to develop a diversity action plan, which is monitored by the Office of Diversity, Equity, and Inclusion. In the county executive's first budget, he ensured that every county employee had at minimum a $15 an hour wage. And this is part of a recommendation, not just through the RACE Commission, but also through the Anti-Poverty Initiative. Monroe County has launched its first ever countywide language access plan, and that has captured national interest. One of our members of our Office of Diversity, Equity, and Inclusion will be presenting at a national conference the work that was done on that countywide plan. In Monroe County, we have mandated equity trainings. However, it hadn't been as closely monitored in the past. Since the development of the Office of Diversity, Equity, and Inclusion, we now have a mechanism to ensure that each employee across Monroe County will be attending or taking part in those equity trainings. And then finally, the county executive has established the Empower Workforce Development Initiative, which creates career ladder paths for individuals working in the healthcare system. And then the last slide I wanted to talk about with regard to Monroe County's response to the RACE Commission report is in the area of human services. What was really highlighted was the number of African-American children who enter our foster care system, and also the rate of placement tends to be higher among that population. Another area was the rates of poverty and lack of access to affordable healthcare, nutritious food, and housing, particularly for older adults who were BIPOC. So in response, Monroe County's Child Protective Services has implemented a blind removal process. What the blind removal process does is it removes all identifiers from the family when decisions are made to remove the child from the household. And then decisions are made not based on the makeup of the family, but the evidence that's put before the team that's part of the blind removal process. The idea is that we remove all of those biases that come with being African-American and or poor in connection with the Child Protective Service system. We're also, as I mentioned in a previous slide, looking at how we deliver services holistically through our Department of Human Services, through our multi-year community integration initiative. And the idea behind the community integration initiative is really to look at our processes, and not just within Monroe County, but with the organizations and agencies that we contract with. looking at how those systems flow to ensure that holistically we're serving our families well. And then in the area of aging, Monroe County Office for the Aging has been designated as age-friendly by the World Health Organization and AARP. And this allows us to look at the 8 domains of age-friendly to ensure it's embedded in all of our systems. This is something that the county executive has embraced. He's had several meetings with his leadership team to talk about age-friendly and to ensure that this process is rolled out smoothly. That's the last slide from Monroe County. I'd like to now turn it over to Liliana Ruiz to talk about the actions that were taken on part of the city of Rochester.
Thank you, Deputy County Executive Crossdale. Appreciate that. On behalf of Mayor Evans and the city of Rochester, thank you for joining us tonight. We appreciate you spending your Monday evening with us. I will take you through some highlights of some of the recommendations that the city has been able to accomplish, with the understanding that there's more, but we will only highlight a few. So we'll start with our business development sector. The one recommendation was to increase access to city and county financial assistance. The action we took was the Kiva program support, empowering Rochester's entrepreneurs with accessible small business loans. And we initiated a targeted business revitalization grant program. A second recommendation was to establish reasonable timelines and enforcement of these timelines so that MWBE companies can be paid in a timely manner. And the city has established the use of the LCP tracker and the B2G Now software to ensure timeliness of payments. Another RASE recommendation that we're especially proud of is the expansion of the MWBE team in the Purchasing Bureau. Just a few weeks ago, we hosted the first ever upstate New York MWBE conference to help minority and women-owned companies across the region learn how to secure government contracts to grow their businesses and to create jobs. More than 200 of these firms attended. This one is in addition to the ones that we did with the county, that the county mentioned. Next. This one I'm especially proud of. This is in regards to our Total Health and Wellness Initiative. This was led by Councilman Lightfoot and Ms. Patricia Williams-McGee. This is to take care of the recommendation of establishing a standing health committee in the Rochester City Council with a charge that includes eliminating health disparities for Black, Indigenous, and people of color. We have established an advisory team for this, and we also created some surveys that will help us identify what those gaps are. And we also held 2 health and wellness fairs last summer. They were successful. We are proud of them, and they were meant for to be targeted for those underserved communities to deliver efficiently services to those neighborhoods that needed them the most. We use American Rescue Plan funds to launch our Buy the Block program that went for the recommendation of Monroe County and the city of Rochester should adopt a policy to support of greenlining, which is what Buy the Block program does. We just celebrated the first ever ribbon cutting in the Upper Falls neighborhood. The Upper Falls neighborhood has some of the city's highest rates of poverty, and that's not by accident. It's the result of deliberate segregation policies like redlining, the outcome of a Depression-era home financing program that denied loans in neighborhoods of color. When you look at the map of the city neighborhoods with the highest rates of crime and violence, it's almost a direct overlay of the areas that the city were redlined. So we are extremely proud of this program. Again, also Mayor Evans created the Quality Housing Task Force, and the final report includes these recommendations listed: increase the scale and effectiveness of the Rochester Land Bank, establishing a housing attorney, code enforcement changes, increase funding of the Emergency Hazard Abatement Program, fund repair and improvement programs, scale the Renew program, provide the incentives of new construction rehab, implement a zoning alignment program. We're providing some home repair grants for existing property owners. We expanded our code enforcement unit and added the housing attorney to go over slumlords who allowed their properties to fall into despair. And I want to take this opportunity to thank the Housing Quality Task Force that Mayor Evans convened last year for their work and recommendations. In job creation, following our collaborative partner, the Monroe County, when they went and did the civil service test for free, we followed in their footsteps. So if you know someone who's interested in applying, you can do so by going online at the Monroe County's webpage or the City of Rochester's webpage. Second recommendation was to ensure that companies are paying well for the work done by implementing living wage criteria. And the action was we raised the minimum wage to $15 per hour across the city, and we signed on to RMAPI's Level Up initiative. Another recommendation under job creation was to create and invest sustainable economic opportunities in Black and Latinx communities to promote and maintain self-sufficiency in entrepreneur and career. And our action to that was the Rock the Block fairs. We held it monthly from July through October. In the city's Rock the Block employment fairs, we brought employers and residents together in fun and outdoor settings. Not only did the residents have the opportunity to meet and conduct on-site interviews with employers and career advancement organizations, and the events also featured DJs, refreshments, and other activities. Under the mental health and addiction services, to answer the call for the recommendation of developing community behavioral health advocates, we created the Office of Crisis Intervention Services, a unit of the city's Department of Recreation and Human Services that provides comprehensive community-based response to support victims and families dealing with homicides, mental health, domestic violence, and other related crises. Creation of the PIC team, the person in crisis, a unit that responds alongside or in lieu of the police and mental health and substance abuse crises. And then down to policing. RPD created a workforce development program to keep police recruits engaged during the month-long hiring process. We introduced an officer wellness program, and I am proud to say we're bringing back the Police Athletic League. They're also moving forward on trust building initiative with the community. Every one of our officers has received de-escalation training. Officers attended crisis intervention school, and our crime prevention officers attend neighborhood events and community meetings at a rate of almost 2 per day, including weekends and holidays. Other actions taken are the body-worn cameras worn by patrol officers, proposed purchase of the BWCEs for other sworn members of the department. We talked about the wellness unit. We're currently planning the trauma training, purchase of an app in progress that not only provides wellness information to officers and their family members, but also allows officers to send confidential emails to the wellness unit. And a second civil service test was offered in April to expand residents' access to the test. And I believe Jamie will help us with the Q&A.
Yes, thank you, Lily. So we've had a couple questions regarding metrics. Nicole asks how the county is determining whether or not the county's Black, Indigenous, and other people of color are feeling, or how they're feeling the difference, and stating that they are having a different experience now that these things have been implemented. And with that, the question also goes to the city in regards to metrics. There's been a lot of discussion, but what are the measurables and deliverables that are coming from these updates?
That is what we're currently working on right now with Cedar Grove, is gathering that data to create those metrics.
Thank you. And Corinda, would you be able to speak to how the county is speaking to the Black, Indigenous, and people of color regarding the updates and how they're feeling after they've been made?
So I had mentioned on some earlier slides about the metrics that were developed specifically through the Office of Mental Health. A lot of that came out of the 90-day report. There was some significant alignment and overlap between the 90-day report and the RASE Commission report. So those metrics are being collected by our Office of Mental Health, and they do track that on a regular basis to ensure that the recommendations that were put in that 90-day report are being pushed forward.
Thank you. So Jenny asks if by the block is a direct result of the RASE recommendations.
Yes.
Excellent. And she says it's a huge accomplishment of the working group. So thank you for that. Richard asks, how many people know about 211? Have they received any calls?
211 is actually, it's actually with Goodwill. It's not part of the city.
Further on down, sorry, I'm going through a lot of questions. Yvonne says, you guys stated that you're a civil rights organization. So questions are, what are you doing about LLC property company in California that owns 200 plus rental properties here in Rochester? And what does the home buyers program, what home buyer programs are available for seniors?
I would have to look that up. I would have to go to our housing department and get back to the individual.
Okay, thank you. And just for everyone's reference, all of the questions, whether or not they're answered here, they are all being recorded. So we will have the opportunity to address all questions, even if they aren't answered here in this format right now. They will be addressed and shared later as well. So let me see. People are asking that you mention your names as you're speaking. I guess it's a little difficult to hear who's speaking at each given time. So I'm Jamie Buss. I'm with the Urban League of Rochester. And you've just heard from Corinda Crosdale from the county and Liliana Ruiz from the city. Ruth asks, are there some special ways for policemen and women to take time off to improve their skills during their time as employees of the city?
Good question. I will have to get back to them because honestly, I do not know if they can take the time. If we could get back to the individual.
Okay. Where are these funds for home repairs and improvements, and how do I utilize these?
The home buyer program is utilizing ARPA funds, which is federal funding.
Okay. And will there be any Rock the Block events held again this summer and fall?
Yes, there is. There will be. And you should stay tuned for the announcements.
Okay. And I assume they can go to the city's website to find dates of that?
Yes.
Thank you, Lily. Chappelle says, kudos to City Council for a standing committee on health. Does the county legislature plan on doing the same? I'm not sure that's something that you can actually speak to at this point in time, but I think we can move on. Okay, so let's see. Are both the county and city promoting the revenue opportunity from the CARES Act employee retention tax credits of up to $26,000 per W-2 employee working up to 30 hours to nonprofits and for-profits? I can ask that again if you need that again. Are both the county and city promoting the revenue opportunity from the CARES Act of up to $26,000 per W-2 employee working up to 30 hours to nonprofits and for-profits?
I don't know.
This is Corinda Crosdell from the county side. I wouldn't know the answer to that question, but we can certainly find out.
Absolutely, same with the city.
Okay. Has there been an increase in the number of BIPOC people who have applied for civil service jobs in the last year? And do you have any numbers on that?
Those are some of the metrics that we are starting to gather now.
Okay, I think that's everything so far. Oh, sorry. Which of the recommendations of the mayor's housing task force have actually been implemented?
Give me one moment.
Okay.
1 moment. We expanded the code enforcement unit and adding a housing attorney. Adding the housing attorney was a recommendation.
Okay, and then is there a status update you can provide for others that have not yet been implemented?
Yes. Yes.
Are you looking that up? I'm sorry, are you looking that up, or they're just wondering what the status is of others that haven't been implemented?
Okay, so we added the housing attorney, we expanded the code enforcement unit, which was a recommendation. I'm looking at them, the fund repair and improvement programs, we are currently doing that. Provide incentives, and we're still currently working on the others.
Okay, thank you. And for those that can't see the panelists, you are able to change your gallery view so that you can see everyone that is speaking at any given time. Up in the right-hand corner, you should be able to show the grid video that shows everyone speaking. I'm going to ask one more question, and then I think we'll move on to more programming. So how can we ensure that our county staff moves from a mandated reporting community to mandating supporting community within child welfare?
The regulations and statute for child welfare are set forth by New York State. So to change state law, that would have to be done at the state level, as opposed to the county level.
Okay. Thank you, Corinda. All right, Dr. Lucas, I think we'll bring it back to you.
Okay, thank you so much. And I just want to thank Ms. Liliana Ruiz from the City of Rochester, Deputy County Executive Corinda Crossdale from Monroe County, as well as Ms. Jeannie Bonds from Cedar Grove Institute for sharing those updates with us. It's really great to hear what the city and the county have been doing so far to respond to the RASE recommendations. We know there is still a lot to be done to realize the impact that the commission was expecting, but I am hopeful knowing that the city and the county are listening to the voice of the community and doing what was asked. We know that we are not going to have everything turned around overnight. Some of these recommendations are going to take some time, but we're really glad to know that you have started working on them. And we at the Urban League, along with our community partners, will be taking that walk with you to ensure that the recommendations are being implemented with fidelity to the report. Again, if there were any questions that were not yet answered or that come up now, please continue to put them in the chat box. We will have them all answered and posted on the website. And again, we apologize for the minor technical difficulty in the beginning when the chat box was disabled. So just moving on now, we'd like to transition to the work that our community partners have been doing to implement some of the remaining recommendations that do not fall under the purview of the city or the county. In its work, the commission went beyond its scope of looking merely at the local laws and policies that were under the authority of the mayor and the county executive, but they also looked at issues under the authority of private companies and nonprofit agencies, as well as local municipalities, including suburban towns, villages, and school districts. The commissioners saw the importance of engaging all leaders in this process if we are to transform our systems and go from injustice and inequity to a system that truly guarantees diversity, inclusion, equity, and justice for all residents. So as we moved into the implementation phase, various community members stepped up to facilitate one of the 8 community advancing recommendation teams, or CARTs, as we call them. The CARTs are community-led groups established by and existing under the umbrella of the Urban League to work specifically on implementing the recommendations that do not fall under any other entity's authority. The CART members spent the last month reviewing and analyzing each of the 215 recommendations to understand what was already being worked on, what was yet to be started, who is responsible for each of the recommendations, how long it will take. They truly did an analysis of each one so that they could identify what work they could step into as community members. What we do not want to do as part of this initiative is to reinvent the wheel, create more silos, or do duplicative work. And so this process was truly aimed at doing analysis so that they can identify those recommendations that were still outstanding, not being worked on, not being taken up under any entity's responsibility, so that they could all we could move them all forward. So with that, I'd like to turn it over to our CART facilitators, who are going to move you through each of their work so far. And the first facilitator will be Ted Polano from the Business Development and Job Creation CART.
Thank you, Dr. Lucas, and thank you everyone for being here, for your questions and for your intentions toward the RACE report. I have been currently facilitating the Business Development and Job Creation team. Our members include John Brock, Galen Brooks, Matthew Burrell, Christina Eisenberg, Tia Goins, Kim Mitchell, Dr. Ogilvy, Annette Ramos, Dr. Robinson, Danette Scott, Glenn Van Laken, and Deborah Witt. Great people working really hard. So for us, we did combine the business development and job creation because there was some overlap between the teams. And the intent, based on the RACE report recommendations, the business development working group, we were looking at identifying structural barriers for entrepreneurs of color in Monroe County, which obviously includes the city, and developing some recommendations to invest in these individuals and helping them with their businesses. Also, the job creation working group was to determine what actions could be most effective reducing employment barriers, and there seem to be quite a few, and disparities, and fostering equity among all the groups. Some of the key findings that were shown in the report, I mean, access to capital was one of the top issues, and BIPOC businesses often have inadequate access to capital, which they need to launch and sustain their operations. Operations and mentorship. Information regarding the available government assistance is just not getting to the audiences that it needs. And there's a lack of what we call culturally competent mentorship. This already got mentioned a little bit, the MWBE certification and contracting. The process obviously has been clumsy. It's been cleaned up, which is really good. But how do we help with that bidding process as well as part of that? Communications and outreach. The input that gathered from everybody kind of said that MWB entrepreneurs have had difficulty contacting representatives in the city and the county, and just navigating the bidding and contract process as well. On the job creation side, there was some difficulty with equitable access to civil service jobs. And we know that that's been mentioned and has been worked on, that system. The MWBE, again, the enterprise, that working with them is also really important, and that overlap between the business development and job creation, but helping them find meaningful job opportunities as well. And job accessibility and equity, just overcoming some of those barriers like transportation, childcare, pay discrimination, different issues that promote problems in that area. Some of the identified challenges and challenges to implementation, really access to capital continues to be big, and it's not one of those issues that can be solved quickly. How do we get CDFIs involved, and how do we create opportunity for people to get access to the capital that they need? Also, MWBEs tend to be smaller and often newer, and that can be a disadvantage in this competitive bidding. Larger, more established competitors can underbid. How do we impact that? There's inequitable and inadequate resources for systems critical to closing the equity gaps. And then the current city, county, state systems possess insufficient economic investment and structures and resources critical to attaining equity. So how do we get all those county, city, state to invest in structures? So our team has been looking at these recommendations, and the key focus areas that we came up with were these three areas: conducting an audit of existing support services to determine shortcomings that are preventing services from reaching eligible MWE businesses. The research has just shown that business owners in the city find difficulty with transparency regarding business development opportunities, how to go about applying for grants, and they would benefit from in-person assistance. The second one is providing matchmaking for MWBE vendors and subcontractors with a host of people like municipal agencies, the prime contractors, major local purchasers. I know the city and county have done some of this work already and are planning on it, but we want to have a little bit different focus when we do it. You know, we hopefully can have maybe some technical assistance for MWBEs to help capture some of the documentation that show what their past performance is, and maybe minimize some of the risks that might be assumed by like a prime contractor. And then the third is audit the city and county's business development services to better coordinate the outreach and communication, which has been a problem. Look at where we can offer ideas on limiting duplication and assess efficiency of current services. Some of the reports that we read and heard, MWB entrepreneurs have had little to no contact with representatives from the city and county. And then without those relationships, they face challenges navigating the bidding process and the contracting process. So we want to be able to plug into that and reimagine that a little bit. Some of our immediate action items. Again, we'd like to conduct a fair similar to a job fair, except the vendors would be like the government departments, showcasing the services they provide. Those relationships are really where these can be made. And if people know face-to-face who's there, get some business cards, make some personal contact that would help them just knowing what the services are and who they can go to. Looking at creating sort of a roadmap to develop that would help business owners identify where they are in a business journey. You know, see which departments would be suitable for their needs. Again, helping them identify, but also plugging in some mentors to help with that. And then want to create a matchmaking system to help the businesses work with each other, you know, MWBE to MWBE, also with subcontractors, but also with mentors. So a system where people could go to and we would plug them in and connect them all together. So for us, the actions that we're looking for help with, we'd love to have some more MWBE voices. That's critical to understand what's going on. People that are familiar with civil service, even though some progress has been made, we could use some folks that are able to do that and offer that. really love to plug into some small business mentors. Again, BIPOC would be the best, people that know each other. We'd like to get some mentors in there. And then if you have skills with communication outreach, if you're good with social media or different ways of communicating, we could really use your help. Right now, we're setting up our schedule. We're going to be on 2 times per month. One would be a daytime meeting and one is a nighttime meeting so that we can get everybody. We're going to be on Zoom. If you're interested, please let me know. My email is in the chat right there.
If we're all set, Dr. Lucas, I'll go ahead with the policing and criminal justice. Thank you. So I am co-chairing this group along with Dr. Rashid Mohammed. I want to thank him for his support, and we've worked hard behind the scenes to try to keep each other in the loop as to what our thoughts are on moving this group forward. I'm really pleased to be working with him on it. And you've seen on the slide who our committee members are. I do want to point out some key highlights on the presentation slide you have. Acknowledging what our intent was in the recommendations from the RASE report. We want to acknowledge national and local calls to reinvent and modernize policing strategies. We're committed to that. We want to review local laws and policies, not specifically for Rochester, but countywide. And in some cases, sometimes at the state level that impact us, that address institutional and structural biases and racism and inequities. We want to pay particular attention to that because those are the foundations for some of the critical issues and problems maybe we've seen or noting. We want to provide a way to enhance current local laws and policies that are effective, but we also want to put to bed any of those that are in effect or maybe are more problem causing than problem solving. And then we want to look at providing recommendations on any new local laws and policies that address identified gaps. Some of our key findings. Looking at the pre-arrest diversion programs, this is under criminal justice, our pretextual stops. I mean, that's an area we've been taking some efforts to identify and examine a little bit further. We want to look at policies within the district attorney and the public defender's offices, as well as court probation and jail policies. These are all things that implement the court process. Also, in looking at policing, we want to examine hiring, training, community engagement, operational practices. I know the question came up earlier about whether police have the opportunity to take a break and go to courses and professional development, work on themselves. I can tell you that does happen. Sometimes it's a little bit difficult to have personnel be reassigned for that purpose, but you really just try to strike a balance. So we really want to work with our law enforcement officials to ensure they have the support to get that done. Some of the challenges we've identified are the complex issues that require legislative, legal, or policy interventions at the state and federal levels. So, for example, we know that one request was to have publicize the full training agenda for law enforcement. That's controlled by the state, and we have no control over that at the local level. So we really have to look at those types of issues and determine where our advocacy is best applied. Another challenge is coordinating actions with a diverse set of community stakeholders, interested groups, and related organizations. We're going to do our best to work together on that, and we will certainly keep you posted. Our key focus areas, as you can see, key for us are the pre-arrest, diversion, and pretextual stops, We know that in our experience, those things have had a bit of an impact in our police community relations. So we want to take a close look at that. Law enforcement, the hiring process. Again, that's not just the city of Rochester, but countywide. We want to look at that and see where we can make recommendations on how to best move that process forward. And then, of course, police and community engagement. It's really critical that our community and law enforcement have an opportunity to work together and problem solve. A great professional told me once, you'll get a lot further doing something with someone rather than to them. And so we want to keep that sort of thing in mind. Getting involved, well, we want your involvement, we want your help and support. And as you can see, some of the things we're planning and doing are holding in-depth reviews of our integrated criminal justice policing CART matrix. We are working with Empire Justice to brief our CART on that report they did on disparate use and impact of police pretextual stops. We'll certainly keep you posted on that. And then we want to review findings from the Monroe County Case Diversion Implementation Project. These are things that we are looking to ensure we get our carts exposed to and we get that information to you. And looking at our calls to action, we need the support and help of legal professionals to give us some of their subject matter expertise. We're continuing to recruit on that. And we want to have the community's participation in a lot of these surveys and discussions. So we will certainly be reaching out to you for your help and support. And we want to raise community awareness of our pre-arrest diversion programs. Want to certainly keep you all in the loop because we know that our best way that we'll be successful with that is if you're involved. And then finally, in looking at our meetings, we're committing to meeting once a month, sometimes 2 times. We're really trying to set up a schedule that makes it work for everybody so we can get a little bit of exposure to a diversity of thought in our community. So that's it for our report on criminal justice and policing. Again, this is Cynthia Harriet, and I look forward to working with you as a community. Thanks again.
Good evening, everyone. My name is Nicole Haynes. I am an educator and love my home in the city, in the 14621 area. And I just know that education has been a change maker in my own life. And that's why I've joined these very dedicated people that you see on the screen in focusing in on the education recommendations. So I just want to say public thank you to all of the names on the screen because they have been extremely consistent in the dialogue and the work that's taking place in the race education CART. We can move to the second slide. What you're seeing here is an opportunity to dig into the larger report. So if you go on to rockraise.com, you'll see what came out of that work. And the intent was to really not tackle issues that weren't being tackled, but really to supplement efforts that were already being tackled in education in Monroe County, and to really try to see a unique approach as to what can the city and the county do with laws and policies that will help us with racial and structural inequities and to build equity. The key findings are that racism is deeply embedded in the culture and practices of education in Monroe County. And that finding came from the commission and the commissioners. And so we, as a team, keep that at the forefront of our work. How are we looking and dealing with individual, structural, and institutional racism as it impacts our scholars and their families? The report also found that there is limited access and resources, inadequate testing and curriculum, and inequitable language access, as well as insufficient funding. And you'll see that repeated again when we go to the next slide after we talk about the challenges. As we're doing our work, what we're noting is that there's limited influence that the city and the county have over what happens countywide in schools due to education law and the fact that school districts and boards manage and monitor their own processes, procedures, and practices. So in order for us to truly be successful, we have to work with and through the current educational structures, whether they are school districts, charter systems, private institutions. We need to get more homeschooling families involved in the conversation, and we'll look at that as well. We're also seeing that we can't clearly see in one place records of the efforts that are being engaged in. So when we're trying to figure out whether or not there are the mental health services that the county so eloquently spoke of that are being provided to our schools, it was very difficult to see, well, who, where, and when is that happening? And so really trying to find a place where we can put records. And I think that is a part of the efforts that the partner talked about in terms of having a dashboard that the community can go to see where there are explicit records of the efforts that are taking place. And then lack of communication across entities has been a challenge as well. And the more people we get involved, I think that'll be, and our team has seen that that'll be a way to kind of get the communication flowing. When we look at our team, it's primarily city residents and people who do their work and their business in the city. So we really need more county-wide representation on the Education Community Advancing Recommendations team, or CART, so that we can have this communication across all entities that are tackling issues related to education. So as stated before, when the commission did its report, it found limited access and resource, testing and curriculum, limited language access, and funding to be an issue. But as a team, we want to know what the community thinks. And so we've developed a survey that has all of the recommendations listed and a few that are the general recommendations. So there are 25 recommendations on the survey, because when you look at the report, there are overarching recommendations, and then there are recommendations that are specific to education. And several of those overarching recommendations, such as significant increase in the hiring of Black and Brown people across the county, across the city, in the Rochester City School District, across the charters, that's an overarching piece, but it is relevant to the education card. So what we will be doing is having a survey so that we can get our community members to tell us what the key focus areas are, and so that we will know what to focus on. And so some action items: we need your input on the survey and support distributing the survey. The team is working right now. I've drafted a survey that I won't share until the team has had a chance to look at it. And then we're going to get it out to the community in as many ways as possible. So we'll be working with the Urban League and hoping all those that registered for this and provided their emails will distribute the survey as well. We need, educational service providers and educational service clients, families, students at the table. We need city and county's employees that deal directly with educational resources at the table. And we meet every first and third Thursday. So if you're interested in being with us every first and third Thursday from 6 to 8 p.m., we welcome you to email contact information to myself. Torian is our Urban League liaison to the education cart. The more voices we have, the more successful we can be in terms of addressing each and every one of the recommendations that are listed. So thank you for this opportunity.
Good evening, everyone. It's a pleasure to be here with you. My name is Thomas Green. One of the things I was thinking of just now when I think about the healthcare cart, and about myself, I'm a native Rochesterian, but I remember Charles Lunsford being one of my earlier doctors. and being able to have some work with the Jordan Health Center as well. So some of the earlier doctors in Rochester who really, really set the foundation for making sure that healthcare was provided to the community, and particularly those that were less fortunate. So thank you again for me being a part of this committee, and hopefully being able to work with many others who have the passion as I do for helping in healthcare. So on our team, we have myself and Jackie Dozier, who may be able to join us later. Joseph Searles, Andrew Seeger, Jonathan Siegel, Rachel Snyder, and Barbara Turner. And we're looking for more to join us, so we'll tell you a little bit more about that in a minute. But the CART came together and understood that health and healthcare in Monroe County was marked by striking contrasts. On one hand, a rich healthcare resource, or two major medical systems, and that operated 4 hospitals, and a center for community health and prevention that supported the facilities, community, academic, public health partners. And then there was Common Health that provided community-based health planning, and the Finger Lakes Performing Provider System. And so there was so many that was there in terms of the richness of helping our community. But on the other hand, our community has some of the worst dire health outcomes and health disparities. And so that was also something that the committee was very, very aware of. Life expectancy range from 72.4 years in some zip codes to 81.1% years in others. And so they looked at that, they saw the mortality rate, or the premature mortality rate, differed by race, by ethnicity, with Black residents being more likely to die from cancer, heart disease, homicide, injury, and diabetes. So these type of things were what was pushing the organization, the committee forward. And what was determined from reviewing the report was certainly that there was a need for improvement in racial health equity. And the committee recommended focusing on social determinants of health. The healthcare work group suggested changing zip code incentives for zip codes, and planning of around development in districts. They recommended in some of the high racial health disparities that there could be grocery stores and pharmacies and community health centers, and specialty areas and recreation and green spaces, and a lot of other things that could help within the community. And so the committee did a lot of hard work. The subcommittee of healthcare did a lot of hard work. Some of the challenges, though, that were brought about in the report was resources and funding, governmental cooperation, making sure that all of our governments, local and county, were working together, state and federal, and also community-based organizations collaborating, and community involvement. One of the things that I've been studying a lot on lately is collective impact. So collective impact is a model that helps us to come together, to work together under one common agenda, one common goal, but with shared measurements that we've talked about doing here, and reinforcing our activities so we have continuous communication and a strong back organization to back us. I don't know if Jackie is here with us. I'm gonna move on ahead. So we had 3 areas that we looked at. First of all, understanding that our group has the opportunity to make sure that there's no gaps in what the report says should happen, and what those who are responsible for doing action are actually doing. And so we have that opportunity to make sure that we're looking at that gap and reporting back to the community and others on what is important. So the areas that we looked at were funding for training and recruitment for Black, Indigenous, and people of color for the doulas, and make doulas available as a public health service. We also felt as though we would be able to endorse and engage in intergovernmental advocacy for passage of the New York State Health Act to provide comprehensive universal health coverage for every New Yorker. And then lastly, we are going to look at establishing private-public fund partnerships to support development of grocery stores and pharmacies and community health centers to help in our areas where we see that there is health disparity. And so those are the things that we believe that as a group we can focus on, again, along with making sure that there's no gap between what city, county has said that they, or the report said they needed to do, and what we believe should have been done. So that is going to be one of the things we do as well. So lastly, I'll just leave you with some of our action items is, again, to make sure that we are giving a thorough review of the recommendations and making sure that there are no gaps. And then we want to make sure that others are involved. This is certainly a community group. We want to make sure all of those who want to be involved are involved and are helping us to make a difference. We are planning to meet on the fourth Wednesday of each month from 12 to 1. Our next meeting, please, when you sign up, we will determine what is the best time for everyone to meet, because we want to grow this committee. And as it grows, we want to make sure that everybody feels like they're a part and are giving their input to what's being done. Thank you.
Thank you, Thomas. Lori Mahoney here. I will start for the housing cart. I am grateful to my co-facilitator, Ronald, and the current active members who are listed here of this team, and former members whose names may no longer appear here, to provide our summary regarding initiatives and to be here to ask for your help. As for my housing perspective, it's been informed for 20 years a volunteer experience with Family Promise of Greater Rochester, formerly RAIN. Yes, I was a businesswoman, served technology companies in sales and consulting roles, started as a teacher. Today I consult right here in Rochester, and started as a teacher as here I consult in the not-for-profit space today. Ron, will you introduce yourself and our team now? Ronald. Oh, you're muted.
I tend to do that often. Thank you, Lori. Good evening, everyone. My name is Ronald L. Washington. I am the housing director and the manager of Home Store here at the Urban League of Rochester. I have recently located to Rochester from downstate to lead the Urban League's housing efforts for the Home Store. I'd like for you to know, before I begin, that the 16 properties that the Urban League owns and about 300 residents are providing affordable housing to quality affordable housing to a lot of residents in the city of Rochester. And under the EDC, which is the Economic Development Corporation, which is the wholly owned subsidiary of the Urban League of Rochester, 41 brand new single family homes were created as the L2P West Side project across the Southwest neighborhoods as rentals to eligible tenants that lead to ownership. I have a unique perspective of serving these clients on the ground while helping them to transition from tenancy to home ownership and preparing them for that time when it comes. Through the 30 years of experience as a real estate broker, mortgage loan officer, and credit restoration and education expert. But that's enough of me, all right? We have a great team of people that are doing great things across the city of Rochester. And I can only list a few because of time constraints. but the current members shown that are affiliated with this CART are Pathstone, Partners Ending Homelessness, Citywide Tenants Union, City Roots Land Trust, Institute for Collective Leadership, Rochester Housing Authority, Five Star Bank, Family Promise of Greater Rochester, Housing Services Network, which is HSN, Rochester Monroe Anti-Poverty Initiative, also known as RAMPI, Fairports Coalition for Justice and Equity, Being Black and the Birds, Third Presbyterian Church, ERG, the Exploring Racism Group, Bergman Associates, Recovery Houses of Rochester, Open Arms Christian Fellowship Ministry, and last but not least, of course, the City of Rochester and that great leadership under Mayor Malik Evans and his staff throughout the city. The intention of each and every one of these CART members and the City of Rochester was and is to increase the volume of affordable housing and to make it easier to purchase and to rent for everyone, regardless of race, religion, ethnicity, and all the other protected classes under the Fair Housing Act of 1968. And to accomplish these goals, the 4 recommendations have focused on eliminating discriminatory housing practices, reducing and eliminating land use regulations like exclusionary zoning, encouraging and incentivizing development of affordable housing, and lastly, supporting and exploring the expansion of community-controlled ownership and rental models, which include opportunities for tenants to purchase, such as the L2P Rochester and other funding mechanisms. Now I'm gonna pass it on to Lori, and I'll take the last leg.
So in reviewing the written report, which summarizes a great deal of detail, we assume, of course, we would have loved to have had access to all that detail, as well as the laws and regulations that are currently in place. Those drive a lot of questions we have around who can do what, the city, the county, the towns. You can read the lists here. It's important to note in our team conversations that we are all learning of so many siloed efforts across our community, all working on positive, unheralded results in their unique ways. And Ron and I personally are intent on sharing this information to break down the silos and to support and help each other in their efforts. Here's where we think this team will focus on slide 3. Thank you. At this juncture, and after just a small number of meetings, we agreed overwhelmingly to advocate for good cause eviction. This is for New York State to help renters who live under no cause eviction rules today, similar to what New York City has had in place since World War II. It extends protections similar to rent stabilization to millions of market rate tenants across the state. Localities' efforts for good cause have all failed in the courts. Even our city council did not want to get involved because it is at the state level. It's been in the legislature for 4 years, and it would cap rent hikes for tenants, market rate tenants, and prevent landlords from ending a tenancy unless they had cause, such as failure to pay. So critical for our area. Upstate has the highest rates of eviction filings, and there are extreme housing shortages here. Secondly, we can research the community land trust model, especially for its sustainability. Upon that research, we want to, in a collaborative way, expand its partnership so that our local City Roots Land Trust organization, which is facing its own financial challenges due to sustainability, isn't alone. And the third potential area is based on our governor's proposed housing compact model in the area of zoning exclusions, which could provide a model for collaboration. So those are the 3 at this juncture. This group is bubbling up. Your input can change that, and we will be meeting, as Ron's going to now tell you. So where do we go from here, Ron?
Well, to make it short, we need your voice. We need your voice. We know that there's a lot of organizations out here that are doing great things, as she had mentioned, in helping to advance these recommendations now. This RASE recommendation has been around for a while. But we have to stay in the moment, we have to stay now, and we have to basically advance these recommendations as we speak in the space that we have. We need to have a conversation. We need collaboration. We need constant communications. We need to ask ourselves, who is missing from this conversation? Who is missing from this table? Who can assist us? Now, everyone is doing great things, but there are so many other people that's not here that can address some of the concerns of these recommendations that can pretty much solve some of these issues that we're currently having. We need to also ask the question, what is working? What isn't working for you as an individual or you as an agency? And we need to talk about those things, all right? So we're going to continue to have conversations, collaborations, partnerships. We're going to meet every fourth Wednesday at noon for at least an hour, hour and a half, or however long it takes to continue to address the RASE recommendations so that everyone in the city of Rochester can have access to fair housing, to quality housing, and the ability to become a homeowner. I want to thank you very much for your time. I want to ask you again, please join us. Thank you very much.
Thank you. I am Sandra Katz, and I'm reporting from the Human Services CART. Our team members included Lori Van Auken, Donette Scott, Carrie Chiswick, Erica Rosenberg, Rose Bonnick, Corinda Crossdale, Sean Futch, Marissa Geithner, Regina Lawrence, and Marilyn Perrin. And there probably are some other people who are on our list who are not on this list. And as we see at the end, there will be an invitation for other people to come and join us. So we'll go to the next slide. So the intent of the recommendations from the RACE report was to increase racial equity in human and social service delivery, removing stigma and punishment from the current system to move towards embedded services that treat people with dignity and respect. And what we found was that child welfare things were happening that were not representative, not proportional. That is to say that African-American children in Monroe County disproportionately enter out-of-home placements by a significant margin. And that was from the RACE report. And something else from the RACE report, eligibility for financial assistance. We found that Monroe County, the RACE report found that Monroe County has a disproportionately high rate of sanctions for non-compliance and fair hearings, and that disproportionality leads to significant reductions of financial support for those in need. And then there's a lack of cultural competency in administering services. Racially inequitable client outcomes result from a lack of policy, administration, practice, and service delivery centered on cultural competency. So this is difficult because these services are complex and navigation and communication is cumbersome. And the other thing is, as we've heard in so many of the other reports from the CARTs, we're all siloed. And so we can see the siloing in this sector too. So we'll go on to the next slide, which is the key focus areas. We want to change the culture around services and assistance for families and children, which connects with the second one that I mentioned in the previous slide. We want to hire cultural brokers and kinship navigators to advocate for families. We want to expand education for workers to increase overall cultural competence. So we can go to the next slide. So how can you get involved? We'd like to gather some more information about the current state of the system. It became fairly plain to committee members that most of the work will need to be done inside city and county systems. Nonetheless, we want representatives from the city and county to inform our community members as to the status of the work. And current members can participate in accountability, and we would welcome participation, especially from those who have received services from a human service agency. We're working on establishing a cadence of meetings. We expect that we'll probably meet monthly for the next few months, maybe more than once a month. And of course, as other CART groups, we'll post dates on the Urban League website, and we welcome feedback and conversation. And we'll move on to the next CART. So thanks very much for your kind attention.
Good afternoon, everyone. My name is Regina Bradley, and I am part of the leading the mental health and addiction card, along with my co-partner, Dr. Kim Medium. So just want to take you guys real quickly through what we've been doing. I just want to start off by saying this card started out with over 48 members. When I took it over myself and Dr. Kim, Maria, I do want to acknowledge Maria because Maria led the card up until February of this year. When we took it over, the count went down from 48 to 13. And right now, the members you're seeing on the screen, this is what we're working with. So these are great, great people. However, we do need your help. A little bit about myself, what qualifies me to lead this group is that I have a lot of experience in our community. I work with 3 different Pop Warner organizations. So I was constantly working with children as well as their family. I understand the sensitivity around mental health. I also ran the Christian Youth Basketball League for over 11 years. So again, serving in our community in work. I've been a leader at my church, an elder for over 11 years. So I believe that qualifies me to take the organization through mental health. Summary of the recommendations, and these recommendations come directly from the RASE report. What was the intent of the recommendations? Well, they were to provide sustainable systemic changes on how best to improve the accessibility and quality of local mental health and substance use services. Now, I'm not going to read through all of this. I know you guys are tired. There's one other card after me. So I'll just, kind of pause a little bit. You can read through it. But I do want to highlight some of the key findings that came out of the report. The Rochester City School District, which serves the majority of BIPOC, you've heard that a lot throughout these presentations, has inadequate mental health and social emotional supports. Another key finding is that the leaders of Monroe County and the city of Rochester together must urgently and repeatedly use their leadership position to catalyze and foster the development of a true system of care that reduces the stigma and serve Black, Brown, and underrepresented individuals. So what were some of the challenges that were identified or raised up in this report? Well, misalignment. Mental health and addiction services are often unaligned and disconnected, as are city and county initiative on these issues. Local research verifies the lack of BIPOC mental health practitioners in the community and the essential role they play in meeting the needs of patients who desire a provider who shares a similar racial identity and experience. And last, most mental health and addiction care is delivered by the region's large private health system and not-profit agency, not by the city of Rochester or Monroe County. So we were asked to identify 3 key focus areas. Well, I received 2. We'll work at getting to the 3, but for now we want to stay realistic with the 2 that we have in front of you here. And that is to develop, maintain, and update regularly a community-wide inventory of mental health and substance treatment resources with online and tablet-based tools that can be used readily by individuals, families, navigators, and clergy for defining needs and facilitating access to care. The second one is develop a city-county anti-stigma initiative in collaboration with local partners for governmental agency, health systems, employers, faith organizations, and community members with regard to seeking care for mental and substance use disorder, which adds to current and future anti-racism efforts. Next slide. Okay, so you asked the question, well, how do I get involved? So I spoke to you earlier about what I felt qualified me. And if I had to just come up with an overarching theme, it would be love for the community, not just as a lip service, but something that you really feel compassion about in your heart when it relates to mental health. We don't have to look very far to see all the challenges that we're having with mental health, whether it be in the city, the county, all over the world today. There's a lot of struggles in this area. So we're looking for people. We're looking for people that have a compassion for people, that are concerned about folks, not just in words, but actually willing to get in, roll up your sleeves, and let's get this done. Someone mentioned about 211 earlier, and how do people know about that? That's one of the things that the organization I'm part of, Together Now, that's what we build on. Our foundation is on 211, having folks go into 211, get the services they need. And then we have this thing called the closed loop referral, where we can actually see who's applying, how these needs are being met. It's one thing to be a service provider, but you're not meeting the needs of the community. So we have a way of tracking that to see if you're requesting a service, is that need being met? How do you feel about it? So I think that's the part that's missing in our community. And that's what I like so much about this tool. So when we're talking about 211, yeah, 211 is very, very much involved. So here's our call to action. Like I said, we're looking for community members. We need people that are compassionate. We don't need folks sitting on the benches. We need you on the floor doing the work. We are looking for successful community initiative. There's some diamonds in the rough that we're not even aware of. Folks that are doing these things in mental health, whether it be counseling sessions and or just sitting around talking to a group of kids, adults. We need to know that. We need you to make us aware of that so we can figure out how do we get services there, because we're talking about getting these services into the community. We can't rely so much on the city and the county. That's great what they're doing, but we can do it as a community as well. Last time, how often do we meet? We're looking for a 2-hour commitment. We have 1 hour for meeting, and then maybe another hour, no more than that, doing some offline work. There's going to be some things that we need to kind of research on and things like that. So if you're interested, I'll put my email in the chat. Dr. Kim, if you can do the same, please reach out to us and become a part of this cart. Thank you for your time.
Thank you, Regina. Hello, everybody. My name is Leanne Rorick, and I'm with the Monroe County Aging Alliance. I am just the deliverer today for my cart. Phyllis Jackson and Martha Hope, both who represent Common Ground Health, are our facilitators. I, along with the co-director of the Monroe County Aging Alliance, Pat Campbell, are both cart members, along with Michelle Sir of Urban League. I can tell you that the Monroe County Aging Alliance represents over 20 different aging providers, and we also have older adults as part of our alliance. So the two of us, while it seems like we have a small cart so far, you'll hear me talk about and pitch why we need more of you to engage in this work with us later. But we're starting small, but there are many of us. Some of the recommendations in the older adult report section of the report are listed here. I want to say that the intent of these recommendations, of course, was to highlight some of the special needs that older adults might have in our community, particularly as they relate to equity. And we've seen some devastating inequity as a result, especially of the COVID-19 pandemic, but other just everyday unfortunate equity that happens in our community that we need to erase and eradicate. And older adults, we know, older adults are facing their own ism, and that's ageism, and that's all of us that are going to be facing that ism. But it's compounded for many of the people in our community. So some of the recommendations. The first one, and probably the most important one I'm going to talk about today because it encompasses so many other things, is to support and get behind the Livable Community Initiative. The Livable Community Initiative in our community was both an application, as Ms. Crosdale mentioned in the beginning of our presentation tonight. We applied both as Rochester and Monroe County applied through the AARP National Network of Age-Friendly Communities to engage in this work. We have support from AARP. The Monroe County Aging Alliance leads this work, and we have 86 different action items of our own, many of which are informed by people in our community. We surveyed over 1,100 people. We had 1,300 others throughout the community, people of all races, ethnicities, religions, people that worked, people that were retired, younger people, older people, people from the LGBTQ plus community, people who are disabled, people of color, people that don't speak English. And those recommendations mimicked many of the ones that you see here. So the resounding voice of our community told us that these were the most important things that we needed to focus on. The Navigator training program, of course, and some of the things that will help older adults actually find the services that they need are some of the most important. So livable communities, of course, is the first priority. This older adult healthcare task force that honestly Common Ground is already doing a lot of work to create this for us, particularly one that is informed by people of all communities and needs, and a real focus on elder poverty and employment discrimination. We don't think of older adults. I saw some comments earlier. We don't think of older adults wanting to buy houses or wanting to find employment, but our community depends upon older adults to continue to impact our economic situation. So we are looking for, you can go to the next slide, please. We are looking for folks, as I mentioned, to dive into these key priorities with us. We are engaging community partners and people of all ages, and we would like to invite you to do so. We are going to meet by Zoom right now. We do understand that sometimes people have challenges and it's just not as easy to do these things via Zoom, particularly with some of the older adults in our community, and we are happy to look at face-to-face meetings if that's what the group of people that decide to engage in this work with us decide. So we have a lot of partners, over 170 just through the Livable Communities Project alone. 7 of those 11 recommendations I showed on that first slide, there's already wonderful community movement happening. We're looking at data. The RACE Commission is looking at data. So hopefully we'll be able to make great impact together, and especially with all of your help. So log into that QR code, or I will also put my email address in the chat if you're interested in joining our cart. And thank you very much. Jamie, I think I'll give it to you next.
Excellent. Thank you very much. We do have a number of questions, and I'm going to get to a number of them, but just a reminder that all questions will be addressed and posted at a later date on our website so people can take a look and make sure that their question has been answered. So starting with job creation and business development. Regarding the starting of a small business, is anything being done to specifically address the BIPOC residents who have a history of criminal justice involvement?
Yes, I know that, I'm not sure with the city or the county, but they have worked on helping folks who have criminal records to have some of that eradicated so they don't show up when they apply for jobs, if that's what you're talking about.
I think just being able to ensure that they do have the opportunities afforded to them, and what's being done to address that.
Okay, yeah, we'll take that into consideration. Thank you.
Okay, thank you. Criminal justice. So what is being done about advocating for an effective police accountability board?
Police Accountability Board is beyond the purview of what's been identified in the RASE report. The Criminal Justice and Policing Card is charged to specifically look at the things that were identified in the RASE report and address them. Outside of that, that is a separate issue.
Okay, thank you. And staying with criminal justice, what does the CART group see as its role regarding education around state policies that remain in motion, such as parole reform?
Again, the CART is charged with specifically addressing the things that are raised in the RASE report or articulated in the RASE report. 5 regarding policing and 3 regarding criminal justice, broad areas. Things that rely on education, I could give you an answer outside of the context of this particular discussion, but that has not been a charge to this particular CART.
Okay. Regarding RASE recommendations, and I guess this is kind of geared toward all groups, but lots of mention has been made by, toward the BIPOC community. Are there steps being taken to support the deaf community and those with limited English proficiency? And this is open to anyone to comment.
7th Judicial District in particular has a Community Justice Council. Community Justice Council has worked for over 3 years, specifically address the needs of deaf and hard of hearing person, along with BIPOC and other marginalized or historically oppressed communities. Changes that have come as the result of input from deaf and hard of hearing people are changes to the court system, accessing the Monroe County Hall of Justice, specifically addressing their needs, and the CJC, the Community Justice Council, continues to have active involvement by the deaf and hard of hearing community to continue to adjust those things regarding the judicial system.
Thank you, Dr. Mohammed. Are there any other cards that would like to respond to that question? All right. For the city and the county, what is being done to hold employees accountable for racist attitudes, behaviors, and biases? And with that, what measures are being put in place to address it, and how do we screen for it?
This is Corinda Crosdale from the county side. Our Office of Diversity, Equity, and Inclusion track all mandated training for equity and bias. Employees who have a complaint with regard to bias or treatment of that manner internally can wage a complaint with our HR department or our Office of Diversity, Equity, and Inclusion. Typically, customers who have a concern address it through either the management team of the department in which they've encountered such behavior, or with the executive team within Monroe County.
Thank you, Corinda. Is there screening that's being done to prevent this from occurring in the first place?
From the county's perspective, I'm not familiar with a screening tool used at hiring that would screen somebody out of employment based on racist attitudes or anything of that nature. I don't believe that that's a practice of the county. And again, I don't know of such a screening tool.
Thank you. Does the city have any remarks regarding that, regarding any of those questions?
We are currently looking for a chief diversity officer right now that will help us with that. But currently with HR, we did implement the budget equity process in which each one of our departments have a team of folks of different levels, you know, from managers to direct reports that do meet monthly to kind of discuss matters of that nature. But if things do pop up or do happen, it is taken care of within our HR department.
Okay, thank you. Regarding healthcare, has there been any exploration of the traditional fears of minority communities in terms of building trust in the communities and understanding of providers in healthcare, and the training of their workers in terms of diversity issues?
I can't speak, this is Thomas Green. I can't speak directly to what's going on. I do know that we do a lot of things in my organization in terms of training to make sure that is addressed. But I am not, our committee is just getting started on our work, and I'll make sure that that is certainly one of the things on the table for us to discuss.
Thank you, Thomas. In regards to education, are there reps involved from the suburban city school districts with predominantly white students? And if not, what are you doing to ensure that they are there so that they can hear about all of the things that need to be done?
Was that directed to a particular part? I'm sorry.
Education.
Okay, good.
Yes.
One of the things we've done so far is there's an organization called the Regional Equity Network. The Regional Equity Network has members from all of the Monroe County school districts. And Dr. Lucas and members of our team, Howard Eagle, Reverend Clifford Florence, Mario Manjon, Fred Tanksley, joined in on that meeting. Dr. Lucas gave an overview of what is currently happening. And then we broke out so that members of the education cart could help those education professionals from across Monroe County learn more about the work of the education cart. And at that time, we had 2 new members join us from 2 of the suburban districts. And so we'll continue to engage and work like that. I did invite members of the Regional Equity Network to this session tonight. I will also send the link to the YouTube to the Regional Equity Network. And that's really, I've been trying from the places where I sit. And so I'm a member of the Regional Equity Network. So I have provided them with information so that, because that is a county-wide body that represents districts all across the county.
Thank you,
Hope
Nicole.
that answers the question.
Thank you. Regarding housing, is there any consideration for increasing the level of home ownership among the BIPOC community as opposed to renters?
Boy, that's a good one. And we know, Ron, I want you to jump in here too. We know that of our Center City residents, about 70% or more, it's more than that from the latest studies, are actually renters, not homeowners. I don't have any answer to that. Ron, anything? Great question.
Can you repeat that question?
Sure. Is there any consideration for increasing the level of home ownership among BIPOC communities as opposed to renters?
Well, with the initiative from the city of Rochester and the Buy the Block and the Home Rochester program, in addition to what we're doing with the L2P on West Side, phase 2 is in the making. Every resident of no matter what their ethnicity, BIPOC, LGBTQ, if I said that right, are eligible and are capable of purchasing a home. That is the purpose of the home store. The aim of all of our partners in our cart is to make sure that home ownership is accessible to anyone who wants it. But what the problem is preparation. The key to home ownership is preparation. That deals with, and we have a saying in the industry, we want to see how sick you are, not in terms of health, but in terms of credit, income, and cash. So from that, we can determine where you're at, help to prepare you for all the steps that are necessary towards home ownership. And that goes across the board. So the key is for accessibility to home ownership, it takes preparation. And that's what I do here at the home store. Feel free to come visit me. I'm in room 316 at the Urban League of Rochester. And I'm easily accessible. I'm still in the office, by the way.
And dressed to the nines. Thank you, Ronald. We'll stay with housing for a minute. Are there any measures in place to assist and address the homeless population?
So I'll take that to begin with. I don't mean to say this is not on our hearts and minds, but it is outside this CART scope because it was not lifted up in the RASE recommendations. However, you must know my world, my Family Promise of Greater Rochester, our start was providing shelter. We have representation on our CART today with Partners Ending Homelessness, Housing Services Network, which is a lot of the sheltering capability here in town. I'm just looking across some of the groups that are here. We do need Nick Coulter's voice, person-centered housing. We need Sister Grace's voice. The homeless is not something we are looking not looking at, but in terms of what this group can advance, it's those RASE recommendations. Call it a limitation of this exercise. We do need to look at that, obviously. It's very, very important. And the whole affordable housing, Roberta Davis, you got a great comment. This is a problem. We do not have a sufficient number of affordable homes. And let's all figure out, how do you determine the word affordable? In the center city, it may be very different. There are so many things working at the same time, the intersections of job, safety on your street, education, just all of it. Not having wealth to buy, ready to buy, and then the whole credit process, the mortgage process. It seems overwhelming, doesn't it? And it's not a good answer, but I'm certainly with you. What can be done? What will be done?
Thanks, Lori. I appreciate that. Oh, sorry. Was that Ronald? No. Okay. I think it is important to mention that, you know, everybody on these carts, you are all volunteers, and there are voices that are missing. And it's important that we identify who those voices are, who's missing from this conversation, so that we can reach out to those that we know can come about this with a different perspective, and one that's more effective than maybe we're recognizing in this moment. So if there are people that you think should be a part of these conversations, please make sure that you are contacting them after this meeting to invite them to that conversation. Regarding education, the group talked about working with the current educational system structures. So separate districts, charter schools, et cetera. Is there any discussion in the group about studying the challenges and possibilities of changing those structures? For instance, consolidating school districts?
Yes, when you look at the recommendations, one of the recommendations is an integrated countywide school system, and it speaks specifically also to like magnet schools. So that is one of the recommendations. As we put the survey out, if that recommendation comes up as one of the top ones that we need to be addressing immediately, you know, we'll do what we need to collaborate in order to do that. But before we make any specific moves, we want to be sure that we survey the community, those that are most direly impacted by the racist structures that we're trying to combat, and see what of these recommendations are priority to them. But that definitely is one of the recommendations that you'll see when you look at the RACE report.
Thank you. For the older adults group, what is being done about the widespread issue of deaf senior citizens being spread throughout Rochester in different nursing homes with limited access to communication? So staff that can't sign, for instance. We need to develop a nursing home for the deaf, or at least develop a large wing in an existing nursing home where deaf senior citizens can be together, language access and cultural access for all.
I'll address that. Thank you so much for bringing that up, Brooke, because this has been such a, I've heard this question over and over. I used to work for Lifespan, I was in the Ombudsman program. I know this is something that is on their radar right now more than ever. And you're absolutely right. We need a place that people can go to, whether they need to convalesce for a short period of time or live for a long period of time, that has the types of people surrounding them that are like them. So thank you for asking that. I don't have an answer to that, obviously, yet. If we did, we'd have a wonderful nursing home that could accommodate that. But thank you for elevating that. And I would encourage you to reach out to us. I would love your voice in our cart.
Thanks, Leanne. The elderly and low and moderately income are being forced out of their homes by the deliberate refusal to build a sufficient number of affordable homes. What can be done? Because the assessments are going crazy, which increase taxes.
I'll speak from the elderly perspective that there are more older adults than ever before that are without housing. And Lori brought up a great point earlier. That's what is affordable. And for most older adults on fixed income, that affordable rent or the affordable rents in our community are not affordable. Just because they're under market rent doesn't mean that people can afford them. It's something that is on our radar from the Aging Alliance's perspective. We have called that out in our plan as well, in the Livable Community Plan. People don't want to leave Rochester because they can't find affordable housing. And there are a lot of community groups that are looking at this, working on it, and realize that it's an issue. Again, I don't have a solution for it for us today, but hopefully with the voice of more and more people, between the housing cart, so many of these are cross-cutting, right? It's not just an older adult issue. I'm sure Lori and Ron would tell you this is an everybody issue, affordable housing. But hopefully we'll be able to come together and find a solution.
Thank you. So Hank Rubin, he says he can't speak right now, but encouraging and supporting home ownership is a priority of the Rochester Housing Authority. On average, the authority supports approximately one family a month with a degree of financing and loan development to support their purchase of a home. So just wanted to make sure that that was said. I think I've gotten the bulk of the questions. If I did miss any, again, they will be answered after this webinar. But Dr. Lucas, I guess I'll kick it back over to you and keep things moving.
Well, thank you so much, Jamie. And I just want to thank everyone who helped plan, implement, and participate in this evening's webinar. That's including our community partners, our governmental partners, our consultants, the staff, and all of you who joined in, asked relevant questions, and participated. I want to give a special thank you to our CART facilitators for all of the work they've been doing over the last 2 months. They are volunteering their time, as Jamie said, in addition to working full-time jobs, caring for families, and handling other responsibilities. So thank you so very much for doing this. We know there was a lot of information shared with you this evening, but this update was long overdue. The report was delivered in 2021, and we wanted to make sure you were informed about what was happening on your behalf. I hope you saw that there's a lot of work being done on all fronts, and there is still a lot more that needs to be done. So there is room for you to be part of this initiative as well. If there's anything that you didn't hear about tonight, or you feel we should be focusing on as part of the recommendations, we invite you to join us. Your perspective is important, and we won't know it unless you are at the table to share it with us. So please scan the QR code that's on the screen, or go to www.ulr.org, or to the RASE website, which is www.rocrase.com, to sign up and join us. You can also read the RASE report on the website. It is in English, it's in Spanish, there's a PowerPoint slide. You'll also see the progress report from the city and the county. We encourage you to read it. As you heard this evening, we are focusing on the over 200 recommendations that already exist in the report. We know that there is a lot of work to be done, and there are so many other areas that we can be focusing on, as was brought up on this call. However, we want to stay true to the work that was already done in 2020 by over 200 community members through the RASE Commission. So we are going to focus on implementing those recommendations before we start adding new ones. But we still want you to be part of this program with us, this initiative with us, because many hands make light work, and together is the only way we can truly bring equity to Rochester. So again, I thank you for being on this evening, for spending 2 hours with us. This will be posted to the website. It will be on YouTube immediately after the end of this recording. Please share it with others that weren't able to join us this evening. We truly want to hear your voice. We truly want you to be a part of this process. You heard that call from everyone that was here this evening. So on behalf of the Urban League and our staff and the RASE Commission, thank you, thank you.